We have always relied on people's best judgment and best sense. I think all of us felt a bit of relief as we were moving through this, and particularly younger people who have been differentially affected by things like job losses and school closures. And there was perhaps a sense that they were being differentially negatively impacted and not being impacted by COVID so much, so they could get out and do this. And you know, I think as well, when we travel and we've moved around BC, we bring our risk with us, and people coming from other places bring their risk as well. And perhaps this is a wake-up call to us that we cannot lose those important things that have kept us safe thus far. And so, yes, we are tweaking the guidance that we have, the orders around restaurants and pubs and those events where we know that these are risky situations, to try and ensure that we can keep things open and allow people to have those opportunities to get together and socialize. We know how important that is, but we cannot lose sight of the fact that if we let our guard down and we have too many people in those places, then it can get away from us. And we are now, there's over 1,000 people that have been impacted by this in the last few weeks. We need to get that down again so that we can all enjoy the rest of this summer and prepare ourselves and be able to do what we need to do going into the fall. I actually have been incredibly heartened by how people have been buying in and continue to do the things that we need them to do. You know, we see groups, and we've said this all along, there's been groups that have been quite visible because they're outdoors, and, you know, the drum circle is one. But people, even within that scenario, were doing their best to keep their distance. They weren't engaging necessarily. Most people that I saw from the videos weren't, speaking really closely to each other. There was not a lot of sort of gathering in those situations which are riskier. Not to say that we condone this, because we don't. We need to be careful, and we'll be working in many different scenarios to make sure that we can encourage and educate and do compliance checks in a way that support people to do the right thing. But I do still believe, and I see it every single day in the decisions that are being made by young people that I'm involved with in my life and by others around the province, that if we tell people what we need them to do, we reinforce it when we see things like this, and we give people the means to do that, that the vast majority of people do this. And right now we have to support each other to continue to keep our numbers and groups of people that we're with small. And if we are exposed, if we are ill, to get out there and get tested, and we can support each other to stay home and stay away from others.
I think we have to put it all into context. I'm concerned. I think Dr. Henry's concerned, no matter how many cases they are, because it shows that COVID-19 is still here. You've seen an increase in cases pretty much 2 weeks ago, 10 cases a week. 11, and now 20, and now 30. We do have to put it in context. We're operating. British Columbia lives in a sea of COVID-19. If you look at the case numbers in Washington State or in Alberta, they would be, I would say, not happy, but probably pretty happy to have the case numbers we've had here. In addition, we now have in long-term care one active outbreak, a very serious one at Holy Family, which is heart-wrenching for all of us that are involved in this issue. But nonetheless, one active outbreak, when you compare that in long-term care compared to where we were a month or 2 months ago. So we've reopened a lot of things. We're doing surgeries. We're having visits in long-term care. All of these are extraordinary successes that are the result of actions of people in BC. And I just think we have to recommit ourselves to this, because the virus isn't going away. It doesn't argue with us. It does what it does. And we have to respond to that by recommitting to physical distancing, by recommitting to washing our hands, by recommitting absolutely to staying home when we're sick. And if we do all these things, we can together flatten the curve and have at the same time a new normal, a different summer, but a great summer together. So I think that this is going to be a challenge for months and months and months to come. And we've got to act in such a way that we understand that. And as Dr. Henry repeatedly says, I think we have to be kind to one another. Often when we see events, and I can recall shots of people on beaches and pictures, I should say, on social media, people on beaches in the month of March. and concerns about ferry terminals in the month of April. And now we hear about other outdoor events, and we see them because they're visible. But I think overwhelmingly, people are following the council. That's what our surveys show. That's what's occurring, and that's what's reflected in the evidence. But we're seeing an uptick in cases, and we got to recommit ourselves to that now in a fundamental way. We're going to deal with this for months. We got to recommit ourselves to the guidance that Dr. Henry and other public health officials are providing us.